Good evening and welcome to the fourth of our online community meetings. Tonight's session is going to be dedicated to the health and wellbeing elements of the recovery. My name is Mark Pepping and I'm the Deputy General Manager, Corporate Strategy and Development Services at Wingecarribee Shire Council. Before I introduce the panellists, I'd just like to acknowledge the traditional owners of the country we're meeting on today in Mossvale. We're on the Gundungurra country, and I pay respects to elders past and present. I also pay my respects and our respects to elders past and present on any other countries that you are all meeting on tonight. As I said, today's sessions are about health and wellbeing, and I'm very honoured to introduce the panel members for tonight. The first one will be Petrea King from Quest for Life, and she'll be discussing the human impacts of bushfires. Our next speaker is Alice Richards, and she's from You in Mind, and she'll be talking about accessing the local psychological supports for adults and young people. Jade Weidner is from Mental Health Program Advisor from Southwest Sydney Primary Health Network, and she'll be working with Daneeka Bertolissio, who will be speaking about bushfire recovery mental health clinician, Southwest Sydney Local Area Health District, and they'll be talking about mental health and wellbeing support services. And lastly, Tanya Smith from Recovery Support Service Community Links Wellbeing, and Tanya's been with us before. So, and warm welcome to all our visitors to this session. Welcome back to those that have been on to previous sessions. As I said, this is our fourth session. And a big welcome to people that might be viewing in for the very first time. We have been recording these sessions and they have been posted onto the council website the following day. So if people are unable to tune into these sessions for whatever reason, by all means, check out our website the following day. So without further ado, I'd like to welcome Petrea King to address the meeting. Thank you, Petrea.
Thank you very much, Mark, and it's very nice to be with everyone this evening. I just wanted to acknowledge a little of what we've seen amongst people impacted by the bushfires in these past few months. As some of you might know, I'm CEO at the Quest for Life Centre in Bundanoon, where we conduct residential programs for people dealing with various kinds of trauma, and where we also go out into communities dealing with trauma to help them in the first few days, weeks, months of recovery. And, you know, it's been a tumultuous time for everyone, and when we go through such tumult, we turn on our sympathetic nervous system, which is the system in our body that prepares us to deal with a threat of some sort. And heaven knows we all went through weeks of feeling that sense of threat, the anxiety of what was happening around us, and then the enormous grief and loss and trauma that's resulted from the bushfires. So that sympathetic nervous system, where you get this surge of cortisol in your system, enables you to run like mad or fight the threat. And that was terrific when the threat was a bear coming into our cave. But it's not so good for the threats that we deal with now that are more psychological, physical, and that emotional threat that many of us have felt both through the bushfires and now through COVID, really complicating the whole grieving and recovery process. So it's not unlikely that your sympathetic nervous system is a little bit switched on, which means it's harder to make decisions. It's harder to prioritize. It's harder to accomplish things in your day. You might find your memory's not so good, that you're a bit clumsy, forgetful, all of these things that I know many people have been experiencing. And that low level of anxiety, because now we're in a circumstance where we're not quite sure how the future's going to evolve. So this is a really important time for us to focus on settling down the sympathetic nervous system in the body and activating the parasympathetic nervous system, which is your rest, soothe, digest system. And that's completely switched off when you're in that state of anxiety or where you've been experiencing this surge of cortisol. Those things are best addressed by being proactive. We know exercise is a fantastic way of using up a lot of the neurochemistry that we secrete when we're under stress. We know that good nutrition makes an enormous difference to our mental health, because our microbiome is actually where a lot of our feel-good, happy chemicals are produced. And in fact, 80% of the serotonin that we produce, which is our feel-good, happy chemical in our bodies, is produced by our gut bacteria. But we need to nourish them with the kind of food that makes them flourish. So your nutrition at this time is really important. Sleep, of course, is so important to reset that system in your body so that you can get deep, restful sleep. At the moment, everybody needs a good 7 to 9 hours of rest at night. And what we're finding in talking to people is that there's a deep sense of fatigue beginning to creep into the community, a fatigue that's born out of that emotional uncertainty that we all feel right now. And I guess there are many things over which we have no control, but we do have control over how we're going to respond to the circumstance that we're in. And given that many people in our community have been impacted by these stressful circumstances over a period of months, never is there more an important time for you to address your physical, mental, emotional, and spiritual well-being. And whether that's by seeking out some counselling, whether it's talking to someone, whether it's getting together and having a barbecue and talking to mates, so that or joining one of the walking groups that are beginning to spring up, the men's groups where they just are shoulder to shoulder to talk about their experience. It's really important to access the various services that are in the community that are there freely available for you to utilise. Because it's not enough to hope that we get through this and through it well. Hope has to have legs. It has to be underpinned by effort. And so it takes a conscious effort to make sure that we are attending to those self-care matters, particularly at times when we can't be bothered because of grief, because of loss, because of trauma. We really need to divvy up our 168 hours in the week. Everybody gets 168 hours. We need to divvy those up, that we replenish ourselves first, before our partner, before our workplace, before the kids. We need to replenish ourselves first. And then we bring our well-replenished self to the challenge, to the crisis, to the chaos, to whatever's going to unfold. But much better to bring your good physical and mental health to these challenges at this time than to bring your exhausted, overwhelmed, slightly depressed self. So self-care needs to be a major priority. And just in closing, I'd like to say that through the generosity of Marcus and Caroline Blackmore, anyone who feels impacted by the bushfires, and I don't mean loss of homes, I mean it's heightened their anxiety, it's deepened their depression. You're very welcome to come as their guest through their donation to a 5-day program at the Quest for Life Centre. We're super COVID safe, and we've had a couple of face-to-face programs now, and you're very, very welcome to come join us on one of those. Please be in touch through our website, or you'll find our contact details on the website as well.
Thank you, Petrea. I should have also pointed out at the beginning, we do have a question and answer ability. So if anyone's tuned in to the session and if they've got any questions that they'd like to ask, there is a function through the Zoom program to put those questions down. But by all means, we'll put all the contact details available on the website. And if people have got questions after the session, they can certainly contact the speakers. But yeah, look, Petrea, I know a few people have already taken up the offer of that 5-day retreat help, which is great. And I guess a lot of people who experienced the bushfires was probably the first time in their life, and some people, you know, well into their 60s, 70s and 80s who had never experienced that sort of situation before. And you can only imagine, I mean, as I did 20 years ago, it's an unbelievable situation, and you just don't know what to do and where to turn to and that. And everyone sort of is at the same point during the emergency and at that time, but everyone's recovery after that then goes in different directions. And, you know, and whilst everyone was sort of building on that recovery, then we got hit by COVID-19, which then disrupted all of that process that we would normally go through in those situations. So, and it's really great to have these sorts of opportunities within our community that help people go through that recovery process. It's really important.
A lot of it's just being educated. Once we understand why we're feeling the way we are, and we hit that point where we say, that's it, something has to change, and it's me. I can't change what happened, but I can change how I'm going to respond.
Yeah, and we were, before we went live, we were with some of the panelists talking about how COVID-19 has changed the way we do things, and we never dreamt of doing these online video conferencings or anything like that. Working from home was something that really wasn't part of our psyche or anything like that. So, you know, some things can certainly make you change, and sometimes it can be for the better, and then other things obviously not so good. So we just have to work with those situations, and as you said, it's about exercise, nutrition and all those sorts of things to help your brain and your body and all that cope with those changes, which is really important. Thanks again, Petrea. So now we have Alice Richards from You in Mind. Alice is now going to take the floor or the screen.
Lovely, thank you. So my name is Alice. I work for Community Links Wellbeing. I'm the Community Engagement Officer, and I also oversee intake for our mental health programs. Our mental health programs are funded by the Southwestern Sydney Primary Health Network, with the support of the Southwestern Sydney Local Health District. So we offer free government-funded professional mental health services. As part of the bushfire response, we are offering support through You in Mind and Reframe. So You in Mind and Reframe are two mental health services that are run by Community Links Wellbeing, that are free services for anyone affected by bushfires. So anyone who's been impacted by the bushfires in the Wingecarribee and Wallandilly Shires. That support is through a number of different ways. So we offer free individual counselling with our qualified professional mental health clinicians. We're also offering some groups as well, some group work, so some free family work that's being done by those clinicians as well. There's also some groups and activities at the moment that has started with some groups and activities for children and for young people that are being done. Again, all free and all for anyone who's been impacted by the fires. Part of what Community Links does really well is that it's a not-for-profit service, Community Links Wellbeing, and it is really a holistic wraparound support. So we work very closely with the Recovery Support Service. I won't talk too much about them because I know Tanya's going to talk about them a bit later, but we're able to work really closely with them to wrap around people so we can provide that psychological support as well as some practical assistance as well. Community Links, I guess, and particularly in our mental health programs, we see health very holistically. So it's mental health and physical health. We often say to people, it's not what's wrong with you, it's what's happened to you. So part of everything that we offer is always holistic services. So part of our programs also includes free access to bulk billing GPs. So we have two different GP clinics that we can connect people to. as part of our programs as well. We have a very simple central intake process for all of our programs. And as I said at the start, I oversee that. So as my role as an intake worker is to oversee intake for those mental health programs. So that can be that people can call our central point of contact. We have an intake phone number. They can ring that number and speak to me and just give me some details over the phone. People can also contact us through our website or through email. And as I said, we work really closely with the Recovery Support Service, who are really on the ground in the community working with people. So that's another great place for referral pathways. We're very fortunate to be funded by the PH in a really creative way. So while we're offering that free individual counselling, there's also opportunities for other things, and Community Links for all of our programs is really interested in getting behind the community. So we work with people to sort of, I guess, gauge what their interests are. So we're really hoping that as virus restrictions ease, we can continue to liaise with people from the community who are coming through, getting some support, and be guided by them to offer some more sort of groups and activities, collaborating with local people. I should also have said already, so I'll say it now, our professional mental health clinicians are all local people. So they all live here locally and are part of the community as well, which is across all of Community Links' programs, and something that's quite dear to the hearts of Community Links Wellbeing. So I can give, I'm not sure if you wanted me to give out details of how people access those services, but as I've sort of mentioned the different ways that you can. I guess just to reiterate as well, as Petrea said, this is free support for anyone who's been affected by the bushfires. We have very varied people who are coming through. So there's people who've lost all their possessions and home and have been really impacted by the fires. There's also people who've been lucky to escape losing their homes and have had to evacuate, put their children in the car and, you know, have trouble driving off because of a backload of cars. But we've also got people, you know, right in the heart of Bowral, who weren't really anywhere near the fires themselves, but have been really impacted, perhaps because the experiences here have brought up previous things that they've experienced with fires in their past. So I think that's a message that we're really trying to get out there, is it's our services, our free services are for anyone who's been impacted at all in those shires.
Thank you, Alice. And yes, I mean, the impacts is not, you know, the immediate fire that impacted on properties, but people lost jobs because they couldn't get access to work and all sorts of things. So there's a lot of trauma that's much more than just the immediate situation. Just for everyone's benefit, the contact details are on Council's website for all of the different services that are being provided. So if anyone has any details, they can find that on the website. I've got a question here, Alice, just about the support for young people, to talk about Reframe.
Yes, so Reframe is our youth service. So Reframe is for anyone 12 to 25 in the Wingecarribee and Wollondilly Shire. So we're supporting our young people who've been affected by the fires through that service. It's a real wraparound service for young people, where we offer a whole range of services, really depending on what the young person is interested in. So we have walk-ins in Bowral and in Tamor. At the moment, there's some restrictions on those just because of the Federal Department of Health guidelines in terms of social distancing. But we man a walk-in Monday to Friday 9 till 6 that young people have access to. At the moment, we're running that as a virtual walk-in, similar to this environment here, where a young person can log in and have a chat with one of our youth engagement workers, connect with each other or connect with us. Everything that I've explained about our services would apply to Reframe. So Reframe is free counselling for young people by mental health professionals who are very youth friendly and youth specific. We also have soft entry points to counselling through youth engagement workers, and we have a peer worker as well, who's actually a really great addition to our team, specifically for people who are coming through who've been impacted by the fires, because he lives in Penrose on property there and is part of the RFS. So there's a nice lived experience sharing there and some sharing of wisdom that comes through that service. So anyone can access Reframe, any young person, and it's all free and it's all funded by the PHN.
We're very lucky to have that service available in the heart of Barrow, in the heart of the Southern Highlands. And if there's anything that I take away, I do like that, not what's wrong, but what happened to you. I think that's a really poignant phrase to come out of what you were speaking about, Alice. So thank you very much.
Thank you.
Yes, so we'll see if there's any questions come along as well. Now, looks like, Daneeka, we haven't got Jade online.
Okay.
Yep, so...
Yeah, I have a little bit of her information, so I'm happy to talk to the dot point she provided, but I unfortunately might not be able to give as much detail as she would have liked, but I will try my best.
Okay, now if we I'll give you the cue. We're just going to try and get that PowerPoint presentation on the share screen. So I've just got a couple of the IT people shuffling the deck chairs to do that. So it should come on fairly soon. Just a reminder, if anyone's online, if they've got any questions, now's the time to jot them down. Okay, there we go. So, okay, so that's, if you wanted to speak to the first page, Daneeka, and then, can you see that okay?
I can.
Okay, cool. So we'll go to the second page, if you like. Yep.
Yeah. Okay. All right. So, I guess I'm going to talk to some of the points that Jade had put together.
Daneeka, it's Jade here. I'm sorry. Can you hear me?
Yes.
I'm so sorry, guys. I got the time wrong. I thought we were starting at 6 o'clock.
Daneeka, you're saved by the bell.
Yeah.
It looks like I got here just in time. I'm really sorry. Did you want me to talk from here, or did you want to continue?
I hadn't started, so you can.
Okay.
Yeah. On cue. Very good. So
excellent. I'm so sorry, everybody. So my name's Jade. I'm the Acting Mental Health Manager at Southwestern Sydney PHN. So we are funded by the Department of Health to support bushfire recovery activities at a primary care level. So that means we're providing services in the community. In the community, but also at the first level of, I guess, support. So generally that is accessed via GPs, and they can refer on to mental health professionals. So on this slide, I just wanted to talk about the different referral pathways. So essentially people can access mental health services privately if they were to approach the mental health professional themselves and also pay for the consultation. The other option is via GP referral, and that includes via Medicare pathways, but also PHN commission services. So the Medicare pathway is called the Better Access Initiative, and that's accessed via a mental health treatment plan. So with that mental health treatment plan, people can access up to 10 sessions per calendar year, and they can also, sometimes there's also a gap payment. So during the bushfires, the Department of Health and Medicare allowed an additional 10 sessions on top of the 10 sessions that people already can access throughout the country per calendar year. So I guess the limitations there, just to note, are that sometimes there are gap fees, and there are generally 10 sessions per calendar year. So the PHN is funded to commission services that support people who are ineligible for, or not ineligible, but for services that are I guess, enhanced to support, sorry, the slides have changed, people who have barriers to accessing better access, but also who require additional services. So we have services that support people from a range of different levels of needs. So if you've got mild to moderate mental health needs, we have a service that matches that. If you've got severe and enduring needs, we have a service that matches that as well. And we are more flexible with the session allocation. So we're not constrained by those restrictions that Medicare put on us, but then also our services are free, so there's no cost to the community at all. So I'm going to talk about a couple of those services. If it's okay to go to the next slide.
Yep.
Thank you. So the first service is Staff for Kids. So this service has been funded to support children who were affected by the bushfires. Sorry, I should say the service has been enhanced to support children who have been affected by the bushfires because the service already existed. So this supports children aged 3 to 12 years, and the service provider is At Full Potential Psychology Practice. So At Full Potential is based in Camden, but they do have subcontractors that service the whole of the Wollondilly and Wingecarribee area. So they are available via referral through GPs. So the Staff for Kids program is accessible via GP referral, but you can also contact At Full Potential directly, who will assist in getting referrals. So the service will connect children and their families to mental health professionals. So that includes psychologists, both clinical and registered, social workers, mental health OTs. And I think that pretty much includes, sums that up. So yeah, it's a great service. They're also providing some outreach, and they also have capacity to deliver groups if required. They have been engaging with schools. So so reach out to Staff for Kids if you have any, support needs for children 3 to 12 years. Next slide, please. So the next service is Reframe. So Reframe, I believe, has already been presented this evening. So Reframe is for young people aged 12 to 25 years. It's based in Wollondilly and Wingecarribee. And it supports young people with all of their mental health needs. So they have a walk-in located at Bowral, and they have one at Tarmore as well. And this service has also been enhanced to support young people affected by the bushfires. And similar to Staff for Kids, they're also providing outreach, so they can provide services outside of their centres. They're also providing telehealth services at the moment. And they also have capacity to run groups if required. So Reframe's a fantastic service. We've received really great feedback on what they're providing. So again, reach out to them if you have any support needs for young people. You can access them via GP referral, but also contact the team directly. So the phone number and their email is on the slide. And the next slide, please. So the last service I was going to talk about is the You in Mind program. So You in Mind is for adults who are experiencing mental health problems. In fact, it's actually any adult or any person aged 12 years and above is eligible for You in Mind. There is a bit of a crossover between Reframe and You in Mind, but essentially You in Mind provides psychological therapy. So it's similar to the adult version of the Staff for Kids program in that it connects people with mental health professionals. It's free. And the session allocations vary. So generally it's around 12 sessions that we allocate. So it's a little bit more than the Medicare funded better access model, but we aim to really meet the needs of the person. So if there are more sessions required, we can do that, but we also can integrate that service into other higher intensity services. So You in Mind supports the whole spectrum of mental health needs, from low, moderate and high mental health needs. So you can, again, access referral via GP or contact the intake team there. So that is a mobile number, but it's the mobile number that's used for intake. So it's the best contact, and you've also got an email there. So both Reframe and You in Mind are delivered by Community Links Wellbeing. Next slide, if there is one. Okay, so if you're interested in accessing more information about these services, you can go to the service providers directly, but you can also go to our website. So the website's on the bottom right-hand corner of your screen. So it's just www.swsphn.com.au, and we have a specific bushfire mental health page under the community section. So on that page, you'll access any information that's relevant to mental health services for people affected by bushfires. And we also have a resource that's been created, which is on your screen, but there's also an open book flyer that you can download, which provides specific information about the services available. I just wanted to flag, I think this is my last slide before handing over to Daneeka. I just wanted to flag as well that the PHN has also been funded to administer community grants. So those community grants are focused around building the resilience of the community and also social connections. So we plan to release those grants in the second part of the year, so sometime soon. We're sort of looking at around September, October in preparation for the next bushfire season. So keep an eye out for that. We'll communicate via our website when those are available. Yeah, I might just hand over to Daneeka, who will talk to you about how we're working together and also what the LHD are providing at a tertiary level.
Thank you, Jade. And just for everyone's benefit, that page that's on the screen now is also on our website as well. So if people don't remember the SWSPHN name, just go to Wingecarribee Shire Council and they'll be able to get the same place. Okay, Daneeka, you're up.
Awesome. Thank you so much. So I'm going to talk about how the PHN and the local health districts are working together. So Southwestern Sydney Local Health District Mental Health Services received funding from the Ministry of Health for one senior mental health clinician, and that's myself, to coordinate the access to and clinical care of people impacted by the bushfires, requiring secondary and tertiary level mental health interventions. So my role as the clinician is to work really closely with the PHN and other agencies to ensure that people are able to access the appropriate services for their needs. And so I thought it would be good to, I guess, just talk to really briefly about what some of the services were already available and currently available within the LHD and within the Wingecarribee area. So Southwestern Sydney Local Health District's mental health provides a variety of mental health services, including the Wingecarribee Community Mental Health Team. So this team provides clinical services to people living in the community who have complex mental health needs and require ongoing care and management. The team works in partnership with GPs, non-government organisations and other health providers to provide a comprehensive package of care to meet the consumer's needs. Another service we have is the Community Mental Health Emergency Team. And so we like acronyms in health, so we call that the COMET team. And that provides a timely response for people experiencing acute mental health issues or acute mental health needs in the community. And COMET has really strong partnerships with emergency care services. The LHD also has specialist mental health services. So there's an older person's mental health team that works within the local area. And there's also the infant, child and adolescent mental health services, which are focused on the younger people that have complex mental health needs as well. So part of my role and how we try to facilitate working with the PHN, the local councils and the PHN providers is that we have, and I coordinate a monthly steering committee meeting. So this includes the LHD, PHN, local council, PHN commission services, and we discuss and provide feedback to each other about what the community needs are and aim to develop a coordinated response to the needs within the community. And another meeting that we also have is a referral coordination meeting. And so this is a regular meeting to discuss referrals and clinical care coordination. And it provides an opportunity for services to discuss referrals and redirect to more suitable programs or services if required. So we really don't want to turn people away if they contact a particular service, but that service can't meet their needs. We want to try and support people in accessing the correct services for their needs. And we also understand that people's needs will go up and down and may, step up and step down and vary as time goes on. And so that meeting gives us the opportunity to identify what other services can assist and, help with referrals as well. So one of the referral pathways, I guess, I just wanted to flag, and the numbers on the screen now, and this is a referral line for people experiencing mental health concerns that may need some of the support within the LHD, and it's actually a triage line, and it runs 24/7, and it's the mental health telephone access line, and the service will refer you to the local community mental health service for follow-up. And so their number is on the screen, and it's 1-800-011-511. And so it's mental health clinicians actually take the calls, and they can actually provide some support over the phone and send people's referrals off to the LHD based services, and provide some follow-up care can be provided. So I thought it was a good number to make sure that people were aware of as well. So that's it from me.
Thank you, Daneeka. So the last speaker that we've got scheduled is now Tanya. And as I said, Tanya was part of our first video conferencing meeting, about 6 weeks ago now, or 4 weeks ago. So welcome back, Tanya. So you're going to talk about information support to individuals and households impacted by the fires, and you're also from Community Links Wellbeing. So thank you, Tanya. Over to you.
Thanks for having me back. So yes, I do work for Community Links Wellbeing, and obviously we have, we're a locally based service. We've been around for about 30 years, so we know the Wingecarribee and Wallandilly really well. The Recovery Support Service is funded through Resilience New South Wales, so we're the government endorsed support service, and our role is incredibly broad. I would say the number one thing that we do is we listen. So it doesn't matter who you are or what has happened to you, our job is to listen and find support. So that could be really practical support around financial assistance, material assistance, helping you navigate through the multitude of grants and the criteria that are attached to each of those grants. It could be helping make decisions about the rebuild process, or putting you in touch with the right people, whether it be talking to council or talking to various businesses and services who can support you in that. There's also a range of different support services. So Alice and I work really closely together when we have people that we feel would really benefit from talking to someone about their experience. We will support individuals and families to either reframe or you in mind. I think for a lot of people, when we first meet them, they'll tell us that they don't need any support, they're fine, they didn't lose a house, they feel quite lucky because they've had support. Doesn't matter, everyone is entitled to support, no matter what that looks like, whether you lost a house or whether you had to sit up night after night with a child who's afraid of, the fires and what was happening. Or perhaps, you lived through this before. Whatever that particular concern is, start talking to us. And usually we find by the end of the conversation, there's somebody or something that we can, somebody we can put you in contact with, or something we can do for you. There are lots and lots of organisations that are set up to help, whether it be through food assistance or material assistance that can help you because you need to figure out how you're going to replace the fencing. So just having that little bit of support can free up some of that cash to help buy the materials for fencing. We can put you in touch with people who will come and help you do the rebuild or help you with clearing. We can refer you to Petrea, who's doing amazing work, and we get such good feedback from people who've been to see Petrea. We work really closely with people like the Southern Highlands Foundation, who most of you will probably know received the fire aid money, and they're doing such a great job of making sure that money goes directly to people who were impacted by the fires. We work really closely with the Salvation Army, Red Cross, so it doesn't matter what has happened. We're happy to sit and talk with you, whether we have to talk for 1 session, 2 sessions, we'll come and see you at home, at a cafe, talk over the phone, whatever it is. But our role is to listen. We are a free service. We are here for as long as the funding lasts. Currently that's about a year, but we're hoping to stick around a little bit longer. The other people we work really closely with is council and community leaders. I wanted to throw that in as well. So we're all constantly talking about what's happening and what's changing so that you can get the latest information. All of our intake information is on council's website, or you can check out the Community Links website as well.
Thank you, Tanya. So we have a question, but I believe it's Daneeka might be finding out, but it's to do with the mental health network still operating, and it provided links between private, other agency, public services. So is Daneeka, are you able to, or maybe?
That was discussed in another meeting, and it's on my list, so I can still follow that up and refer that back to the other meeting for that one. That's fine. I can't really give an answer at the moment. I haven't been able to follow up on that yet, but I'll do that.
Okay, thank you. So I haven't got any other questions that have come through at this stage. I'll also like to mention too that we have the social recovery small grants are now open for applications, and those details can be found on council's website. It might be easier just to go to the website because it's a long, but it's to do with guidelines, social recovery small grants program. So if you Google that, and I know Kat's online and she's been sending me little messages. Is that the funding that council got, Kath, through the state government's recovery, community building and recovery grants?
Yes, it is, Mark. So with that money, we've allocated it to health and wellbeing initiatives to focus on bushfire affected communities. Yeah. So we're asking people, hopefully you'll find it an easy application process. There are guidelines attached there, and we're asking people to think about initiatives that focus on the 5 ways to wellbeing. And for people not familiar with that, there is an attachment there to give you a bit more information about what that is.
Thank you, Kath. And I'll just check again. No, we haven't got any other questions. So we're nearly at the end of our time. So I'd just like to once again thank Petrea, Alice, Jade, Daneeka and Tanya for joining tonight's session. I hope everyone found it useful. As I mentioned earlier, all of this information, it's all been recorded this session, so it's available to watch again tomorrow. And all of the information is on the respective agency websites as well as council's website. So I don't think we can, I don't think anything's been missed in that regard. And just before we sign out, we have another session booked for the, set up for the 13th of August. So that's in 2 weeks' time, and that will focus on council's environmental recovery team and our environmental unit. So if anyone's interested, or pass the word around about the environmental recovery, that will be a worthwhile session to tune into. So without further ado, I'd like to thank everyone for joining us this evening and wish you all a good night, and hope the weekend will be dry for you all after the rain that's been very welcomed. So bye-bye.